All right, so welcome Facebook Live. Sorry we got a minute or two late start, but we are now live for our webinar, Ask the Doc. So I am Dr. Paul Ledesma with Ledesma Foot and Ankle. To my right is Dr. Polini. She'll be assisting me in the technology part and getting some questions answered as you guys hopefully tune in and get started. So we're here in Scottsdale, Arizona. As you all know, and I'm sure you're interested at this point to learn about what kind of things we're going to talk about today. Just as a quick update, you know, we are in practice here in Scottsdale, Arizona, and we are trying to stay open as much as possible for the patients that are in need during this unprecedented time. This is really a very unusual situation that we're all in, both in healthcare especially, and just as a general public. It's one of those things that, you know, we as medical professionals have an obligation to treating our patients in all different types of scenarios and situations, and really just for their benefit. We wanted to produce this broadcast so that way you could have an opportunity or chance to ask questions, to get advice, whether or not you should go into the office. Is my injury to my foot or ankle bad enough? You know, should I be worried? Do I need to risk the chance of exposing myself going out into public or a doctor's office to decide? And you know, those are the kind of questions we want to see or hear. In particular, what your problem is, and we'll give as best medical advice as we can through this type of format. Quick disclosure, you know, again, answering questions in this way, in this format, not having performed a real life or even in telephonic or video consultation, please don't take this as your only and sole medical advice and instructions. I do always recommend you refer back to your physician who is perhaps already treating you, and to discuss any particular details about your health issues. Again, we're here to just advise and give recommendations. We're also going to go over some tips about things that might be coming up in today's society in regards to not being able to go and do your normal routine or go to work and do your normal activities during the day, and you find yourself with a lot of extra time. You know, perhaps you're working out a little bit more because you got the extra time to do so, and but you're having some problems with your feet, or maybe an injury that you incurred while you were working out or exercising, and what you can do about it. So we're going to go over some general recommendations as well. And with all the questions that we have, if we get enough of them and we're unable to answer some of them, we do plan to go further into another broadcast, or rather a series of videos to answer each question as best we can. And I'll do so in a video format, so that way it's one thing to just tell somebody what it is or how to treat yourself. It's a whole different concept, I think, to show you what it means, or maybe help you identify where that pain could be coming from. So as long as we're getting the questions, we'll continue the broadcast. I will have to cap it at an hour, so that I don't have you all day in front of the mobile device or computer. But in any case, we will go ahead and open the format to any questions you might have. So if there is a question that you want to pose now, feel free to go ahead and start typing, and we will do our best to screen any or all questions that we're getting through the feed. I will start. We did actually get a few questions already when we posted the event. So I'm going to go over a couple of those that we got on our message board in regards to this event. So, did I leave anything out?
I think
We
so.
covered everything.
Covered everything.
Let's see.
watching. No questions yet.
Okay, great. Just real quick before we get started, in regards to our practice here, we've got physicians that are coming in and treating patients in both in-person, depending on your emergency or problem, as well as providing telemedicine visits. So that is something that is available to you, and for most of your practitioners, the government has been nice enough to waive any restrictions that we would have normally had in providing telemedicine from your home. We can pretty much all now do that without any issues from a billing and reimbursement standpoint. So those are allowed and encouraged at this point to help you keep your social distance. If you really don't need to come into the doctor's office, we would encourage you to ask your doctor or call us about setting up a telemedicine visit. In regards to the things we offer, all services here in regards to trauma, we have x-rays on site at our office, diagnostic ultrasound, several therapeutic treatment options to minimize, again, having to go out to another facility for those services, as well as offering some minor in-office procedures for infections, or like if you ingrown nails that could potentially get worse, we can actually take care of those in the office with a small procedure. So, and the other things that we're doing in light of the pandemic, so we are doing our best to protect not only ourselves and our staff, but also the patients that come through the door. And I think this has been pretty commonplace amongst a lot of offices and colleagues that I've spoken to that are still trying to stay open for patients that are in need. We are screening people as they walk in the door with a temperature. We're also going through a questionnaire based on any recent travel, respiratory issues or symptoms, coughing, sneezing, and making sure that if anyone does have these types of issues walking through the door, that they are asked to reschedule. We're limiting people accompanying the patient into the office, so we only really allow one extra person, more so if they need assistance getting into the room and getting to the office, or if it's a minor, to be as a chaperone. And we are asking anyone additional that comes with to wait outside. We have chairs outside in our courtyard. There are outdoor benches at our facility, so you will be asked to wait outside the office to minimize more people being in our waiting room at any given time. And we also offer kind of drive-through service, so to speak. You can come to the facility, park in your car, call us, and once you're here, we actually will call you back once your room is actually ready to go into. So you go right into your room once you get into the office, and we sanitize the rooms and all the surfaces that could be touched as soon as you leave, and so that's ready for the next person to come right into the room. As it works, it's been working out really well. I don't think we've had more than maybe 1 or 2 people in the waiting room, keeping well a good 6 to 12 feet apart from each other to maintain that social distance. So, so those are just a few updates in general about us. And going into, now we're going to go into the section for answering questions. There were 3 questions that were posed to the website or the event posting that I had that I've already started to answer, but I wanted to go into a little bit more detail. One of them was a fairly simple question, but it is something that I get a lot when we're here in the office. So one of the things that comes up, especially in our climate, being in Arizona, is dry skin, especially during the winter. You know, luckily we're hopefully going to be out of winter real soon and get the nice warmer temperatures to kill off the virus.
Yeah, that'd be great.
But a common issue or question and problem we get is dry skin. It's like, how do I combat, or what do you recommend for just treating dry skin or cracked heels and fissures? We get that a lot. And one of the basic guidelines that I give my patients is to make sure you're choosing or looking at the ingredients of the moisturizers that you're going to be using on your skin. General rule of thumb for me is to try and avoid petroleum and mineral oil based products. mainly the reason is that it would be no different using those products than just taking your foot and wrapping it in a plastic bag or a saran wrap. It traps moisture and it does it pretty well. It forms a barrier around your foot or skin. But the problem is if you have dry skin to begin with, you're not going to be trapping anything. So your feet will just stay, for the most part, dry. Now, if that's not the case and you do produce moisture, then trapping moisture does tend to work. What I like better is using plant-based or water-based type products. And there are a few kind of animal products like goat milk, cow's milk, that you can benefit from a moisturizer with those as the main ingredients. Shea butter, cocoa butter are another good kind of plant-based products. And then you've also got some of the oils like coconut oil and avocado oil, olive oil. And then there are certain ones that are more water-based type lotions and creams. And all of those are pretty acceptable. One of the things that in line with dry skin that can also be an issue is developing little cracks or fissures, especially around the back of the heel, because that tends to be a hot spot for dry skin and problems. In a pinch, again, advice if you are trying to avoid coming into the office for a problem or have issues with really bad cracks and dry skin, first off, try to remove as much dead skin as you can, soaking, using a pumice stone or a file. And then another real simple trick that you can use at home if it warrants it, meaning if the crack is getting very deep and painful and you're worried about an infection. One of the tips that we tell patients if they can't come into the office to be addressed is to, if you have super glue. Regular glue doesn't work as well, but it can help. But I prefer super glue because it dries very quickly and it forms a kind of airtight, waterproof barrier. If you're pinching the skin together and then applying some super glue directly over the fissure or the crack in the skin, and then it can hold it together for hopefully long enough until the underneath can heal. So one little tip that might be helpful for some of those who have really bad issues with dry, cracking skin.
Quick question for you. Would you advise them what other areas, like if they're out first aid, could they use that super glue for?
Yeah, so in a first aid situation, if you were on the trails, let's say, and you were hiking and you cut yourself climbing on a rock, and first off, at all possible, if you have access to water, and hopefully you're hiking in the desert at least with fresh water, do your best to cleanse the wound first. If it's not too deep, you can try cleansing it and then using the super glue to pinch the edges of skin together.
Kind of help it to stop bleeding,
exactly.
kind of thing.
Right. So that's a great
tip.
question. Another question that we received was, and again, specifically a question in regards to whether I should worry about it now or later, was we got a question about someone that fell and hit their knee and injured some of the cartilage on the inside of the knee. This particular person had already had a knee replacement on one side and was actually being scheduled because of the fall and the problem she was having afterwards for the replacement on her bad knee coming up in May. And in line with the federal government and the recommendations from President Trump's department about surgeries, and all elective surgeries are recommended or advised to be postponed. And in my opinion, in regards to our line of work, which doesn't comprise of a lot of orthopedic type procedures, elective procedures, my opinion would be to postpone any elective procedure. And most of the time, joint replacements are elective procedures. Now, in regards to, what if I have a lot of pain and problems or difficulties? Again, my advice is to talk to your orthopedic physician. Most likely, they're going to have trouble scheduling the joint procedure to begin with. And the best explanation I can give you for that, and it's not just because it's elective, But what it does is if, for instance, we were to book, Dr. Collini here for a bad knee, okay, maybe she's in a lot of pain, is having some difficulty walking, and we decide to go ahead and do it. So right now, if we were to do the procedure and schedule it, there's two big problems with that. First off, the procedure could be going great and everything's going fine, but all of a sudden, she may have problems with the anesthesia, which happens a small percentage of the time. And it often happens to do with your health status as well, or just having a reaction to the anesthetics that are being used to keep you asleep. Then we have to transfer you to the hospital. Now that poses a lot more problems in light of today's concerns with the strain on healthcare. Now you're using resources that can't be used to fight the pandemic, and there's a higher risk of exposure.
Yeah.
Now you have to go to the hospital instead of your outpatient facility where you're having the surgery, and exposing everyone involved with your care.
Yeah.
So that's really kind of one of the biggest concerns about having elective surgery right now. And then even if you get through the surgery just fine, we do your bunion surgery and everything comes out great. But then within a week, you notice the incision is red and it's getting really painful and swollen.
Right, any complications?
Now you have a complication. And very likely, surgical complications often require very strong antibiotics.
Yeah.
And most of the time, there aren't the right kinds of antibiotics to treat serious infections, especially post-operative, by mouth. It's something you can't just go to the pharmacy and take it home. So now you have to go to the hospital to get an infusion or an IV.
Right.
Same thing, you're really putting
Extra strain.
additional strain,
Yeah.
right, to the healthcare system that is really doing its best to reserve all efforts towards fighting this pandemic and people who might be affected. So that was the second question, which was a great question. And again, I'm not trying to tell anyone exactly what they have to do, but for my own patients in our practice, we are postponing all elective surgeries until we get advised otherwise by the federal government, and even more specifically on the state level. Because we really don't want to make, put any additional strain on our health system when we're trying to fight this all as a global community. Next question. We did have another another interested potential viewer that came up with heel pain. So, and she had already reported to me that she had a large heel spur that had been diagnosed, had spent quite some time in the retail industry as well, and she had been a competitive, skater as a young adult. So, young adult competitive ice skater, 30 years or quite a few years in retail services, wearing certain kinds of shoes, and just really struggling with heel pain. Now, heel pain is a very big topic that I'd love to go over in complete detail, but I could easily talk about it for over an hour. There are so many things that can cause heel pain. Pain first step in the morning, something that may seem to get better as you continue to walk throughout the day but worsens towards the end. These are all pretty common descriptions of certain types of heel pain. And that's really one version. So that's often a very common one when we are diagnosing plantar fasciitis. And fasciitis meaning inflammation of the tissue on the bottom of the heel. Can you pass me those models? So part of the beauty of doing a video is that we get to show you cool things like this. And in just a few moments, I will be asking one of our live models to help us out with some demonstration. But, and actually, why don't we do that now? Do you want to, Russ, you want to come on down? So we have a willing volunteer to help us out with some of the information and demonstration purposes. Say hello, Russ.
Hello there.
Real quick, Russ and I are good friends. We're training partners. We wanted to give a quick shout out to our Professor Gabriel Riverdo and his professor and teacher, Professor Flavio Almeida. Hopefully they're watching, or some of the guys from the
they
gym.
are. There's some guys from the gym.
Can we put in a plug for gbarizona.com? Can you post a quick link?
And how do you want to handle questions that come in while you're doing a demonstration here?
Just keep a post and just try and pick out some good ones that we can go over. You know, as like all industries, especially fitness-wise, all the gyms that we know, I think all of them have been closed. And Gracie Barra is a Brazilian Jiu-Jitsu studio that has been in the Valley now for a number of years. They have several, I think up to 10 studios, I think, in Arizona, a couple in Tucson, and the rest are here in the greater Phoenix area. And one of the things that, like many studios that offer these types of classes and martial arts disciplines, they're trying to do their best to adapt to the times. We've been taking online courses, doing classes with our professors live, and just making a little place in our living rooms or, you know, garage. Hopefully you have some mats, or even on just the rug. So communicating with our professor, they are trying to develop a introductory course or online type of class that even if you're not a member, you can actually try it. So that hopefully when things blow over and we're all back to normal, you might be interested in coming and joining us on the mats. So thank you for tuning in, guys. We look forward to being with you in person and in getting back to our workout routines. So, all right, Russ. So real quick, let's take off your sandal. And so for demonstration purposes of where plantar fasciitis, and I think this will probably be, at least to start, a helpful tip or hint to maybe what you're dealing with. So the typical plantar fasciitis pain, which again is a tissue that coats the bottom of the heel and the foot. Many times the pain from traditional plantar fasciitis is on the inside, or what we call the instep of the foot and the arch. And a lot of people say, I have pain in my heel, when they might be talking the back of their foot, or the center of the heel, or even the arch itself, which can actually be a different problem altogether. But traditional plantar fasciitis, which here in our office we typically confirm the diagnosis with a diagnostic ultrasound where we've actually visualized the soft tissue. An MRI can also be performed. It's quite a bit more expensive than the ultrasound, but still very good at identifying the inflammation to the tissue. The plantar fascia is a band that runs from the ball of the foot all the way down to the base of the heel. And typically when people have pain or inflammation, it's located right around the inside portion of your arch towards the back of the heel. Not the very back, but the inside bottom section. And typically with a hands-on evaluation, the pain will be there where my right thumb is now. And if you have pain in other spots, it could indicate that you have problems with more than just the plantar fascia. You could be having tendon problems in the arch, even though most people think it's their plantar fascia, which it is partly there. There is often a very painful tendon problem that can occur when people have so-called heel pain. Then there's pain that tends to radiate towards the side of the heel on the inside of the calcaneus, which is the bone in the back of the heel. And that can even sometimes radiate up the leg, which could indicate more of a nerve issue. And then another version of heel pain could be coming from the back of the heel. Sometimes we do see heel spurs or growths on the back of the heel where your heel cord or the Achilles attaches to the back. And this is a different type of heel pain that in some cases is treated a little differently than traditional plantar fasciitis, which is again back here on the instep of the arch. So a lot of things that we talk about with our heel pain patients. First and foremost, if you research any of the information on plantar fascia, one of the first things they'll tell you to do is stretching. And it's an important recommendation to keep in mind. And the connection is not so easy to understand. Some people say, oh, you're stretching the plantar fascia, right? Not exactly. So what's more important to remember is that the plantar fascia actually is it's almost like a fabric or a canvas belt. So like the belt I'm wearing today, it has no stretch. It's a band of tissue designed to support structures, in this case above the plantar fascia in the arch. What can stretch are muscles in your body. So muscles are really the easiest tissue in the body to actually stretch and retain some of that flexibility memory. So in the foot, you have very limited muscle tissue in the bottom of the foot. So the calf muscle and everything above that, in your thigh, hamstrings, that's where you're going to get the most benefit from stretching in regards to heel pain and treating heel pain. And for the most part, all heel pain, Achilles pain, tendonitis, plantar fasciitis, all of them have and are affected by the muscles in the lower extremity or the lower leg. So we focus on stretching the calf muscle and to a lesser degree the hamstring. And there's lots of different ways to do that. We have, let's see, do you want to grab me a night splint?
Questions are coming in too, so.
Do we have any work related to this?
Not specifically, they're like some side effects of blood pressure medicine and some painful feet in the morning,
Okay.
so.
Okay. So, again, going back to pain in the morning, one of the first things we teach patients to do, thank you.
Use pain in the first few steps.
First few steps.
This is related to what you're talking about here.
Right. So, and let me backtrack a little. Before, in the first step in the morning, there's two things that you can do to help with that in the short term. The first being, make sure you can do as much as you can from a flexibility stretching standpoint before you go to bed, because it's really the activities of the day and the use of this muscle that will start to reduce the flexibility overnight as the whatever lactic acid you've produced during the day from exercise or just moving around, it tends to cause a contraction or a tightening of the muscle. And when you get to the morning and you start to put weight on the foot, a lot of the tightness is in the leg, and also any inflammation that may have occurred and collected overnight is in the bottom of the heel, all in one place because you haven't been walking around. As soon as you step and take that first step, immediately there's a lot more pressure that your body is experiencing when you put the heel down because of all the inflammation. And then on top of that, your calf is really restricting easy flexion of the foot to take pressure off of the heel. So you've got two things happening, and that's why it's so painful in the morning. So to combat that, in the office, if we were diagnosing you with heel pain and tightness in the lower extremity as a result, this is a nice little splint that we can suggest or recommend. You can find things online as well. There are socks, there are what we call posterior splints that there are available online as well. We stock these in the office, and in some cases can bill insurance for them. This is one that goes actually on the top of the foot and the ankle. So you would slide it on and attach it to the foot first. Raise your foot up as much as you can and secure it down to the leg. So what it does is it actually maintains a semi-stretched position of the foot, and it doesn't allow your toes to drop, which allows your calf to tighten up more as you sleep. And this will help to reduce a lot of the pain in the morning. And if you don't have a night splint or some kind of device to help you with this overnight, or even for a few hours, one of the easiest things you can do is first thing in the morning is to do a little bit of stretching. You can use a towel, you can use a belt, and wrap it around the front part of your toes and pull your foot back. So what that looks like.
Okay, I can jump in with another question that's related to this.
Okay. So make sure if you're taking a towel or a belt, you wrap it to the ball of your foot and you relax the leg. Relax the whole. Russ is tightening up and flexing. So So, but you would relax the foot and imagine a towel wrapped around the foot and pull back with the knee straight, and that'll put a little stretch on your calf. If you can do that, and then for a minute or two rub with your thumb the ball of the foot and the heel, where the pain is coming from, that should help reduce some of that pain. Or if you have any kind of device that you can pull out, a rolling pin or a little massage tool, and you can actually, before you step down, is massage out the arch and the heel, so all that pressure that's built up overnight isn't all in one place when you take that first step.
So for people that are kind of, they've suffered with some plantar fasciitis, for this one person writes in with, for about a year, done some stretching, done some occasional physical therapy, but now the pain seems to have gone to the outside of the foot, towards the little toe, and to the middle of the foot. So, so something else is starting to happen.
And what often can happen when someone's suffering with a certain kind of pain for a long enough period of time, and it happens a lot with heel pain. And because heel pain is often on the inside of the arch and the heel, reflexively, one would try to walk away or adjust how they walk so they're not putting pressure on the inside of their heel. That would then put pressure on the outside of the foot, which can overload and overstress tissue on the outside. So for that person, they're probably causing some either tendonitis on the two tendons that are located just behind the ankle bone. Okay, you've got two tendons that run side by side, and one that attaches right here along the side of the foot. If you feel your foot, there's a little bony lump about midway through the arch, right in here. One tendon attaches here, and the other keeps going and wraps all the way to the inside of your arch into the middle on the other side of the foot. So we often will see compensation, is what we call a compensatory tendonitis, when people are trying to shift their weight away from the painful side. And also another common problem is arthritis or aggravation of the joints on the side of the foot. Because the middle of the foot and this side, it's almost like a little jigsaw puzzle. A lot of square and trapezoidal type bones, not meant to move around a lot. But if you start putting excessive pressure or tension, it starts to cause these joints to move much more than they normally do, and that can cause a little irritation. So that particular person could be having one or a combination of both of those things.
Yep.
All right, any other questions?
The same lady who wrote in about that transfer pain also has pain that's going up the leg, but as you pointed out, this, so she's having, I'm not sure if she's talking about the outside of her leg or the inside.
So that again, transfer pain, out of those two things that I just mentioned that could be happening, either tendonitis or arthritis here, or irritation to the joints. The tendonitis is probably more likely what's causing pain going up the side of the leg. You can have inflammation up the tendon sheath or the covering that surrounds the tendon, and then it travel up into the muscle. There are also nerves that can get involved, but again, depending on physical examinations and the types of symptoms, it could be any of those issues. The best thing is to work on the original problem along with the symptoms you're having from the problems with compensation as well. And it's again what we call biomechanics. So the way that your body functions, if it's functioning inefficiently, we have to work on your efficiency and your biomechanics to improve it, so that way you're actually starting to function in a more normal manner.
I have a question from somebody in the Chicago area, wondering if there new onset of swelling in the feet and ankles, wondering if it's medication, and wondering if yoga in the evening would help reduce swelling in the morning, if you experience any swelling in the morning.
Okay. So swelling in the feet and ankles, we do often get that question a lot, and people coming in because of that, they're not sure where it's coming from or why it's there. First off, one of the things that to keep in mind is if you have swelling in both feet at the same time, both ankles, there is a higher likelihood that it could be coming from either a disease condition, like metabolic issues that you might be having, because you're affecting both extremities at the same time. In some instances, there could be vascular issues that are causing swelling in the ankles. Venous insufficiency or vein problems can often lead to chronic swelling.
The difference between swelling in the morning and the evening, what would you say about that too? Can you speak to that?
Swelling in the morning versus the evening. So swelling in the evening could very well be just a result of the day's activities. Your body's had close to 12 hours or around that of time for gravity to pull down extra fluid down to your ankles.
So maybe even like a vascular compromise situation.
So it could be circulation related, not necessarily an acute problem, but certainly something to take note of and have evaluated at some point.
And if that swelling is gone in the morning, then it's probably more vascular, but if it shows up in the morning, perhaps it's more systemic.
Right. So if it's there in the morning, there could be some kind of condition that your body is dealing with that allows the swelling to progress through the night, even as you're resting. And if it's only in the evening, it could just be the physical activity combined with just poor venous insufficiency or valvular incompetence, which is just a problem with getting blood back up to the body once it's gotten down to your feet or legs and ankles.
Great. Did I interrupt your what you were saying about the plantar fasciitis with the demonstration? Sorry.
Oh, no. So again, heel pain again is a very broad, in our opinion, very broad topic, but very common and very popular. A lot of the things that people go through besides stretching, at the end of the day, icing. So if you were to imagine this was a frozen water bottle, you could take that and roll it to the bottom of the arch of the heel. Tends to be a nice massage to help you get rid of some of the fluid buildup, as well as cooling down the tissues. Arch supports are other things that can be helpful. These are different versions of arch devices that you can either have made for you, or there are some similar devices of reasonable quality over the counter.
It's nice that you bring that up because we have a patient asking about a question. Can orthotics help with back pain?
They can, and again, it varies from person to person depending on what your foot type is like, and if there's enough instability in your feet, that can actually travel up the body through just ground forces. So if you imagine the body is it's like a building, right? So all buildings in most cases in today's society are built on a foundation, usually a concrete slab. And if the slab has any defects or unevenness to it, and you put a building on top of it, what happens? You can answer this, Russ.
Fall down.
Yeah,
Really easy.
fall down. Yeah, but what do you see in the walls? You'll end up seeing, or in the floors, you start to see cracks, right? So a very common issue that we do see a lot, even in our profession here, is that your feet are the foundation of the body. If there's instability in your feet, it can very likely cause cracks in our building, in our bodies, through the legs, through the knees, knee pain, hip pain, even lower back, shoulder and neck pain, and even spine pain. There are even some studies that prove and or can show a relationship behind TMJ and really unstable feet. And so to answer the question, can it help with my back pain? It's possible it can. If the inefficiencies are bad enough in your feet, they can travel up to the lower back or in the spine and cause problems. So there is a possibility, granted with an evaluation or visualization perhaps, if you were hesitant to go in, to see what kind of foot type you have, and if that foot type has a tendency to create back problems, then your answer would be, it may be, orthotics or arch supports. One of the things I was talking about with a patient the other day is that if, again, you can't be here for the custom pairs of orthotics, if you really did need that, there are some good brands over the counter that you can actually purchase online. So I've gone onto Amazon and looked up orthotics, over-the-counter orthotics, and some of the more popular brands like Power Steps. I believe you can get Superfeet.
Okay, can you speak about, what do you think about Dr. Scholl's or other ones?
So Dr.
Surely
Scholl's,
there's a
yes,
huge
there's a
range,
huge,
there's a huge amount of money you can spend in that range.
there's a
so-
huge variety of the quality of what you can get over the counter. And unfortunately, they're not built all the same. My advice is in general sense, and again, this all depends on the problem you're having, what requirements your foot actually needs. Because there are plenty of people that buy Dr. Scholl's over the counter and they get better, they feel better. The issue is Dr. Scholl's or whichever device you choose hopefully addresses the problem that you're having. Those are questions you can bring up with the provider. And right now you could do a telemedicine visit and try and work that out.
Like, are you using because your heels are sore, or you want arch support,
Right.
or do you feel an instability? Those are three different, very quick reasons, and I don't think a Dr. Scholl's from over the counter is really going to do a whole lot with
Right.
lateral medial instability.
Well, so the analogies that I like to use during regular office visits with arch supports, over the counters, which one's the best for me? And my answers are, again, it depends. If you need stability, if your foot is too flexible and too unstable, you want to stabilize the arch in the foot. But to do that, you can't just use soft material or cushions. So you wouldn't build a bridge, for instance, out of pillows, right, Russ?
Yeah.
So
Not if you wanted to stay up.
So if you wanted the bridge
I'm
to
no
stay up,
engineer, but
and the foot is very much, the foot is very much like a bridge. It has an arch. It's a concave arch or convex type surface, or concave. Sorry, and it's like an arch. So if you put an orthotic, a device that's supposed to hold up the arch, and it's made out of soft, cushy pillows, like a lot of the, sorry to pick on them, but the drugstores and the grocery stores sell, your arch is just going to collapse. It's going to flatten out. And it's not going to achieve what you're looking for. Now, if you have a sore spot or a blister or a bone that kind of sticks out on the bottom, then a cushion might be helpful, a soft one. But overall, I would say you need to be kind of careful and do your research about what types of orthotic do you need for your foot, for your type of foot problem. And the quickest answer would be talk to a doctor, maybe a telemedicine visit, and that could really benefit you. The last thing I'll say about orthotics and just even in general is that your custom orthotics, they're not all made the same either. The word custom really means they can be made out of anything. What it means ultimately is that they're form fitted to your arch specifically, not his arch, not her arch, which is what you would get if you just buy it at the store. A custom orthotic is going to be made from a impression or cast of of your foot, and that's the big difference. The second step is really where another important part about orthotics lies, and that's designing the orthotic to meet or deal with the problems that you're actually having.
Yeah.
And that's kind of the art of prescription writing from our end, knowing what that looks like. A lot of people think
you'll go into a gait analysis. We'll look at your hips level, your
Right.
knees level. We're going to look at so many different things that all contribute to how a prescription gets written and what kind of modifications we're going to put on that. So
Right.
a lot goes into this. Is a really medical device by the time we're done with it, and so that's why it's on this side of the spectrum of quality versus what you can just run into the grocery store and buy. That's a one-size-fits-all kind of a thing.
Yeah.
Won't address the problem, so.
good. All right, let's move on to another question. Do we have any that you've screened so far?
Somebody is saying that they have nerve pain that's in their ankle. It doesn't go away, drives her crazy, and she's tripping a lot now because of it.
Okay.
I don't know if she's coming in to see us. You can address that, and then you can also maybe tell people what kinds of things they can call in for. What can we do with telemedicine? What kind
Right.
of questions can we address? How can we help you?
Okay. So the
Nerve
first
pain
part,
with tripping.
nerve pain and tripping. So nerve pain can be very difficult and tricky to deal with and to treat, and obviously very painful. If nerve pain in general, it's a little unlike traditional soft tissue injuries. So when you sprain your ankle, the first thing that most people would do, and then I advise, is what we call the RICE protocol, which is rest, ice, compression, and elevation of the injured area. It helps to address the inflammation that's a result of the trauma. But whereas nerves are a little bit different, oftentimes they don't like ice. Now in some cases when it's burning, that's immediately what you think to do. And for some people, it's not always this way, but for a lot of people, ice and nerve pain, it actually doesn't help. So you can actually try heat. Sometimes increasing blood flow to the tissues actually soothes it better than actually trying to cool it off. Medications can be used. There are some injectable solutions that you can try, and obviously you would be coming into a doctor's office for an injection. But there are a variety of medications that can be prescribed in attempts to control some of the symptoms with nerve pain. Your Tylenol and Motrin are just your over-the-counter pain medicines, which some addresses pain and some address inflammation. There are more specific medications that specifically deal with nerve pain as well, but again, those would be under the supervision of a physician. Stretching, mobility are also other good things to keep in mind when dealing with nerve pain. Even though it may hurt to move or walk on, if you're just sitting, try to massage and keep the tissues flexible. That often will help with nerve pain. So keeping it immobilized and rigid, like with some injuries, if you twist your foot or have a fracture, those do better with keeping things still. Whereas nerves tend to be better with a dynamic motion, with hands-on massage, a lot of times heat more than ice, and then again you've got some medications. So hopefully with with that particular problem in tripping, we do want to make sure that is it something neurological that's causing the tripping or a lack of motor function, or is it just because of the pain it's making things a little awkward and clumsy. So definitely consider scheduling at least a telemedicine consult for that type of problem.
Okay. Any ideas or thoughts on cheap nail polish that you buy at the store versus once you get it at a salon? Is it gonna hurt you, damage your nails in any way, or?
It's a good question.
Home pedicures.
Not as well versed on all the various types of nail polishes that exist.
I can jump in here and say
that would be more on Dr. Polini's side.
So I definitely try and go more natural as I can and keep out. There's several pretty toxic chemicals that they put in the polishes, and so I don't like to get my nails done at the salon. One, I've seen too many people come in with fungal infections. And having the nails cut down too deep in the corners. Also, I've seen people, elderly people come in who've had a really rough pumice job and actually created an ulcer on the side of their foot. So we see some injuries and infections coming in from the nail salons. And then on top of that, of course, always putting that coat of polish on your nails. It just encourages the growth of fungus because it's the nail polish creates a dark area underneath the nail bed. The sunlight can't get to it. And so you can get an infection that develops that way. So, and then just the caustic nature of those chemicals in general. I mean, I have polish on right now, but I bought it from Sprouts, and it's lacking all of the it leaves out all of the chemicals that are so harmful for us, like formaldehyde and toluene, and there's several other chemicals that they're this long. I just know that, I don't want those chemicals in my body. So I would say, if you're gonna put polish on, make sure it's something that's as natural based as you can find. Be very careful going to your nail salons. They can cut too down deep into the corners, creating ingrown toenails. They can seed infections and give you fungal infections. And then, come winter, give your nails a break and keep the polish off of them and let them be natural for at least 2 or 3 months. And that'll keep a healthy nail. So that's what I would say about that. Thanks for that question.
One last comment on that particular topic. There are some antifungal nail polishes available on the market.
Yeah.
Dr. Remedy was a product line that I used to carry at the office. And I think they're still in business, so that you can go online and I think order antifungal nail polish. Which, if you gotta wear nail polish, you might as well also use something
Treat it,
that
yeah.
can either preventatively treat a nail infection,
Yeah.
or if you have a small infection starting.
Yeah,
So
so that's
that would be a good alternative.
And so that's
Other
about
questions?
anything, no. This person developed horizontal cracks the last time that they used polish, so.
Yeah.
Again, that could just be due to the harsh nature of the chemicals that are constantly
Sure.
on that nail bed, depending on your overall nutritional health, your general health. Sometimes our health shows up in the quality of our nails, so could be a vitamin deficiency as well. Might not have anything to do with the pedicure or the polish that you use. Could just be some type of vitamin deficiency as well.
Right. There's a couple of supplements too that you can consider taking for nail health. Vitamin A and E are always known for skin health. And there's also biotin, which is a supplement you can buy over the counter. And that's often helpful for encouraging better health of nail growth and hair as well. So we're getting up on about an hour.
So we're pretty
right?
close. Yeah.
Okay. Do we have any other different types of questions, or?
No, I've pretty much got to the ones we covered. Orthotics. We covered some nerve pain, some plantar fasciitis.
Okay.
And that's about everything we talked about so far.
Okay. So, do you have any questions, Russ?
I guess quickly I would say, you might wonder, what can your podiatrist do for you over the phone?
Yeah.
Right? How can we handle over the phone? You'd be surprised how many people come in and have a pretty benign problem, but they're not sure what it is. It's benign to us. We understand what we're looking at. So, but it could be as easy as calling us up and saying, hey, I've got a red sore, side of my toe is red and sore. I stubbed it the other day. What should I do? We can give you some initial things to start off doing at home that may help. And then if those measures don't work, then you call back and say, okay, it helped a little, but it's not getting better. Should I come in? Then we can say you can come in. But at least we can start sort of triaging you in a way so that you don't have to come in for all the kind of ongoing concerns. Like, we can start you off, if you have heel pain, we can talk about, did you just start an exercise program? How long have you been wearing the shoes you're in? Have you recently gained some weight? We'll start talking and asking all these questions, and then we'll go into what you can do initially at home. And a lot of that, you get started on your own, and then if you need more, then we say, okay, yeah, you need to come in for some therapeutics. We've got, an ultrasound machine. We check the thickness of your plantar fasciitis. We've got a shockwave machine. We've got laser. We do, we also can refer out to physical therapy. We can show you exercises to do additionally to what we've told you. So there's really a lot that we can actually initially handle over the phone. So please don't feel concerned about calling up and saying, hey, I have a question about what should I do with, because you'd be surprised how much information we can give you for that initial visit. And then, like I said, if things don't progress in the direction that we're both hoping, then it looks like it might be necessary to come in and we have to maybe do a small procedure, or we have to put you in a pair of custom orthotics because you just can't walk. You've got to get out there and do some walking or whatever, and you're even too much pain to do it. Or maybe you of course, if there's a real accident, like you've twisted your ankle, you've something's blown up, you dropped something, your nail's starting to come off, it's black and blue because you've been running now, because you're out there exercising, because you got nothing else to do. So please don't hesitate to give us a call, because you'd be surprised how much we can really answer and help you with, at least initially, the beginning.
Yeah, and again, a lot of, we run into this as well, and I think Russ can attest to, people that exercise on a regular basis may come across injuries that, it'll get better in a week or so, it's just a sprain. But there's some kind of guidelines that you can use, and again, we're obviously here to help you with that if you're just not sure. But my kind of general rule of thumb, and all of us have a little slight variation, but most minor soft tissue injuries that are not going to cause a lot of problems for the future, they tend to improve within a week or two, maybe 3 at the most. But if the pain doesn't seem to be improving, the swelling to the area doesn't seem to be improving, despite what color it might be, but it doesn't seem to be getting better over the first 2 weeks, there is some concern about a more serious condition. Ankle sprains are probably one of the biggest ones that a lot of people just blow off thinking it's just a sprain. And rightly so, a lot of times it may be. But there are a few times when it's not just a sprain, right, Russ?
Yep.
So fractures are a real thing, and depending on the type of fractures that you might have had in the ankle may dictate whether you need surgery or not.
Yeah. Might be walking around in a fracture is what we're saying.
Right. So
Which I
anyway,
did for about a week.
You did,
Yeah.
yeah, see?
yeah,
It happens.
Russ figured it out in about a week though, but
They had a few broken bones
that
in
was
his
okay.
ankle.
So
Yeah.
we got him taken care of.
So we're probably just a few
what time
minutes
are we
here. We're just 56 in,
Oh,
so you
56.
can go ahead
So we
and
got a
either
couple
wrap
more.
up or.
Well, we got a couple more minutes. We are going to wrap this up, but you know, again, one thing about icing. So if you're nursing an injury, if you're out on the trails recently and you take a fall, icing is probably one of the quickest things you can do to help with the swelling. One little tip that I love giving to patients, because they're like, well, yeah, but I don't have an ice pack. Yeah, well, you probably do. If you have anything frozen, anything in your frozen vegetables in your freezer, those are perfect little packs or tools, very inexpensive. Now this is our official Ledesma Foot and Ankle ice pack, but if you don't have one of these nice gel packs, you can buy a frozen bag of peas.
Looks a lot like this without the
And
logo
it'll look
on
a
it.
lot like that without our logo on it. So, but it's moldable. So because of the nature of the peas, you can mold it right around. And one of the cool little tricks I like, can you hand me that shirt? It's there. Another quick little tip, if you don't have an ACE wrap, which is the stretchy elastic bandage, is if you have any old t-shirt or one you don't mind using as an ice pack case. So you take a t-shirt, long sleeve, you tie up the end so you can't, it's not open on both ends. So you tie a knot in the end, right? Put your ice pack in the neck of the shirt. Use the arms to then tie it around your leg. Okay, so in a pinch, this is a cool little thing you can do, and it's already kind of somewhat designed to hold the ice pack in place. You know, you can use other stuff, but this is one of the quick things that most people have an old long sleeve t-shirt hanging around. So quick little tip for those of you even on the trail. So if you get hurt and you have the ability to grab some ice and you got a long sleeve t-shirt with you, use that, you know, until you can get other better supplies.
Okay,
Okay, so
59.
okay, well, we started a little bit late. Last thing I'll say is, you know, especially here in Arizona, sandals are a big question we get a lot of. And the only reason I'm going to bring it up right now because I'm noticing our model's lovely, very flat sandals and thongs, which are fine. You know, we're not really doing much here today. But if you're out and about and needing to wear shoes or sandals for a longer period of time, consider getting something with some arch to it. You know, many years ago I sat on a committee for public education for our profession, and our goal was to educate people on common foot and ankle issues. And believe it or not, the topic of wearing more sandals or flip-flops came up, and is it causing problems with our feet? And oddly enough, it was unanimous in a room of about 15 physicians, all from all over the country, that yes, we are seeing more patients come in with toe problems because they're wearing sandals all day long. They're wearing them to school, they're wearing them to play sports in, and just do every daily life things. So wearing a good sandal can combat a lot of that. So I'm gonna pick on your sandals, Russ. No worries. I'm gonna get a little closer so you can see the quality of the flatness of this one, how nice and flat that is. It's a nice cushion, but it's very flat, non-supportive. Whereas compared to this one, you have quite a bit of an arch, a rounded mold to fit inside the arch of the foot. Like this, okay? So lots of different companies that make sandals. Some are nicer than others. Here's another type of sandal, nice rubber sandal, Ufus. This is a Vionic sandal, which we're retailers here for. You can buy those online as well. And there's a lot of pretty sandals that, because that used to be the complaint from women that, oh, they don't make cute flip-flops. So, I don't know, Dr. Polini approved these. So, these are nice for Vionic sandals for women. All right, anything else did we get any more questions or any more?
I lost my feed, so is there anything else on there?
Did we find anything else?
No? Okay.
All right, so again, I really thank everybody that tuned in for the seminar. Again, we plan to do this more often. I'll most likely start coming up with topics and questions that come up from both our patients, or if any feedback from the website or from the seminar or on our Facebook page. I'm going to be going over video answers for some of that, for those questions.
One of the ladies tuned in, I didn't see her before, tuned in Lily, the pain on the top of the foot. Is that something you addressed?
Oh, yes. So,
Very
my
quickly?
apologies, I forgot. There was one other question we did get before the seminar started, and it was a problem with discomfort on the top of the foot. Now, on the top of the foot, it's very unique, and let's try this one to not detract from your tattoo. On the top of the foot, there's a very common spot that we tend to see problems with. And in particular, if you can turn your foot a little bit this way, Russ. So right here. So I'm going to put my finger on this spot. And it tends to be the highest part of the arch, really right on the top of the foot. And again, on the model, I'll show you here.
You want to come in closer?
So,
You can come in with the
all
camera
right.
too.
Well, you can try zooming in too.
Oh yeah, you can zoom in.
Yeah, zoom in. Zoom in a little bit. Okay.
Just so they can see exactly where you're pointing, because we're kind of far away at this point. And then you can hit the screen to clear it up.
There you go. Okay, that's good.
Yeah.
Okay,
Just
so
wait.
the top of the foot, try and turn here, Russ. Right about the peak of the arch, it's kind of in line with the second toe, and there tends to be a little bone spur or natural prominence to the arch and the bone or the foot that's right in here. And if you actually take your fingers very lightly and kind of press on the top of that part of the foot, you'll actually feel a pulse, or you should. In most people, with exception about 10% of the population, you'll feel a pulse. And this is actually one of the more common areas to check a pulse in the lower extremity. It's called the dorsalis pedis artery. But with that artery tends to run a nerve as well. And for a lot of patients that have pain because of the bump on the top of their arch, on the top of the foot, with wearing shoes, you're wearing a material on top of the lump that's also next to the nerve. So you've got a bone spur in some cases, or a high part to the foot and bone pushing the nerve up into a shoe material that can cause a lot of pain. So the first thing you can do is to try and reduce the pressure to the top of the foot by making sure whatever shoe you're wearing is a little bit loose on the top. Or
Let's talk about laces, yeah.
one little real quick easy trick that you can do with your shoes, and what size shoe are you?
Not that big.
Is to change, oh, these are 11s, change the lacing pattern on your shoe. So we're going to pretend real quick
close
that Russ has that big bump and painful spot on the top of his foot.
I can show you my foot. I got the big bump and painful
Oh,
spot.
you do?
I do. Got that nice big bump there.
You're welcome to whip it out.
Want me to take, excuse me.
Okay, so first thing you do is you take the laces down, not all the way out, but enough to open up the tongue of the shoe. Okay, so here's our spot right here. We're going to put the shoe on, okay, and then you basically eyeball where the lump is in regards to the lace holes that it corresponds with. So for these two holes is where your painful lump is. So what we'll do,
Do you guys need to zoom in at all?
I'm going to take the shoe back off and start going back and lace the shoe back the way it was. But when you get to those two spots, we're going to do a technique we call boxing the laces. So you're creating a little window and you go up the side of the shoe. And once you do it, you're going to really kind of kick yourself going, wow, that was easy. Saved me a lot of pain. Okay, so now you put the shoe back on, okay, and there was the spot, and I'm going to turn this way and put your foot down, so you can see there's a little window of laces that are missing and not crossing right over that painful lump, and that can decrease a lot of pressure to that nerve and perhaps create a little bit more relief. Now there are times when that doesn't really help a lot or enough, and there are different reasons why just the top of the foot could be hurting. It could be arthritis. There are a lot of instances where we see arthritis in the middle of the foot. Again, that really dense band of bones that are right in the middle of the arch. When there starts to be a little bit of motion, and over time the cartilage wears down, you can develop a lot of inflammation as a result of that. So sometimes just, again, getting a better arch support in your shoe can help to reduce the motion going through the middle of the arch, and that can address some of the arthritis. X-rays are a very common thing to take in that case, so you'd want to start to reduce your diagnosis down to more ones that are relevant depending on the appearance of the bones. So hopefully that answered that question with a little bit more detail. I do want to thank everybody for tuning in, and we look forward to hosting more of these live webinars as well, and also keep a lookout. We started a YouTube channel, so Ledesma Foot and Ankle on YouTube. Please feel free. I posted the first video announcing this webinar. Feel free to subscribe, because then we're going to get you'll get notifications when we post our videos coming up, the answers to all and other topic like questions that we're going to come up with, and all kinds of cool stuff. We're gonna show you some of the really cool therapies that we offer here at the office, some of the advanced treatments that we're doing here that are a little bit unusual and not your typical therapies. Some of the cool procedures that we're qualified to do that are a little more advanced and more cutting edge. So we do like to offer that option for all of our patients and all of our conditions. I want to thank Russ for coming in and being here to help provide us a foot model with lots of decor. Dr. Polini, again, one of our partners here, chiming in and helping me kind of screen some of the questions. On the next one, we'll also introduce you to my other partner, Dr. Randolph, who's sitting in the back in the wings. We'll have her.
Sure, come on in, say hi.
Yeah, come on in, Jess.
Feel free to write in with any questions that you have throughout the week. If things come up that you think of, so that we have other things to talk about if people aren't, so we can answer your questions.
Right. So please use our Facebook page, use our YouTube. If you can comment on the videos, feel free to ask questions there, or just email us. You can go onto our website if you'd like. It's ledesmafoothandankle.com. Very simple. You just have to spell it all out. And there's a place where you can send us a message. And again, like I said, we're located here in Scottsdale, Arizona. So, and we're not opposed to helping anyone in the country at this point, because we all are in the same boat with this pandemic and,
Yeah.
and the situation with COVID-19. I think we all could use a little help, and the nicer we are to other people, hopefully that comes back to us when things return to normal.
Okay.
So thank you again, and we'll catch you guys soon. All right.
Bye-bye.